One question we get a lot when people come in is, do they have to pay for Medicare? Is there a cost to it? And there is. Medicare is an insurance program that you have to pay for. People who make more money have to pay more for it. That's part of the Income Related Adjustment Act that was passed by Congress that requires that people who make more money have to pay more money for their health premiums by looking back 2 years to your income. And I'll give you an example that if in 2004 you had $109,000 of income or less, then you would pay the base premium, which is about $202, and there's no real charge at that level for Part D, which is the prescription coverage. However, if you look back to 2024, and your income was above, let's say, $500,000, then the top Medicare bracket, the IRMA bracket, is $690. And that $690 has another component to it, which is the Part D component, and that's $91. So combined, you're up over $700 all of a sudden from $200, because 2 years ago you earned $500,000. You can plan around some of this by looking ahead and seeing, hey, I'm going to be 65 in a few years. I want to make sure that my income 2 years before is lower. And you can do that by timing some withdrawals. You can time bonuses and accelerate them into years beforehand. You can do Roth conversions, capital gains. One interesting thing is that if you retire and all of a sudden your income is going to drop, then you can petition the Social Security Administration by filing a form requesting they reconsider your premium amount. And they can do that pretty much right away when you file. So that's an option as well. They sometimes will consider that. So it's important, to do the planning up front, to understand that there is a premium, that there's premiums get higher as your income gets higher. So how can you reduce that premium? You can do it by doing planning up front, taking the time to look at your income and move it down so that you're qualifying for lower levels of IRMA adjustment. Thanks.